Hi, I'm Dr. Margreet Wibbeling, midwife specialist and your host of the Birth and Baby show, brought to you by Sister Lillian Center and Sensitive Midwifery. We empower moms and midwives to have the best birthing and parenting experience through natural, physiological and intuitive care, resulting in birth and baby advice you can trust. So hi everyone, we are back here with a lovely new episode that we've prepared for you, and we are going to be talking on giving birth in a government hospital. So as you know, we are busy with a series on birth options, and we've talked about loads of different options and angles on giving birth. And for many women out there, the only option you've got is giving birth in a government hospital, and there's nothing wrong about that. And this is a real good option as well, but we also know that many women might have some fears or have heard horror stories or had bad experiences. So we really want to use this episode to empower you and equip you to have the best possible experience in a government hospital. And for this beautiful talk, I found a lovely midwife that is passionately working in a government hospital, and she's all for natural birth. This episode is sponsored by Mosaic Marula Oil. 100% natural marula oil is the most excellent natural topical treatment for pre, during and post-pregnancy skincare. And Mosaic Marula oil is just that, 100% natural marula oil and nothing else. Daily application of Mosaic Marula oil will nourish the skin with naturally rich concentration of vitamins, minerals and antioxidants found in marula oil. This will allow the skin to retain its moisture, remain supple, emollient and soft, all while it promotes new cell growth, collagen production and the skin's elasticity. Well, no cream or oil can simply erase stretch marks from your skin, but making mindful decisions about what you apply to your skin, your diet and what you drink can make a huge difference. It is also never too early to start nourishing your skin with 100% natural marula oil to help prevent those stretch marks, or it is never too late to help reduce their appearance. Visit www.marulaoils.co.za for more information, to order online or to locate an agent closest to you.
I work in government. I've always worked in government. I've done a little bit of private work here and there, but really not much. My heart is really in government. So I'm actually very junior or almost intermediate level in government, because it takes forever to become a senior midwife. So I've been in government for 9 years. I started at an academic hospital in one of the country's metros, who serviced a big population. It was a level 3 hospital, so very sick women came in. It was a very very stressful environment to work in. But it was a great learning school. And I think the thing that I really learned there was how not to do it. And
Wow.
So I don't think you can work in that environment and think this is the best that there is, what you can do and do for women and for yourself as well. So since then, I took a short break just to get over the horrors from those early years. I went to Turkey for 1.5 years and then really got very passionate about midwifery, came back to South Africa, and now I'm at a smaller government hospital and really loving it and having so much opportunity to let women just birth. So that is me work-wise. Definitely.
Oh, wonderful. So I'm so happy to hear that you're just so passionate about being in a government hospital. I also really have a special love for it. I've done many sessions myself in different settings, but Kirsti, you are definitely the right person to talk to about this topic, because we are busy trying to empower women on having the best possible birth and to be equipped for themselves. So For a woman that's maybe a first time pregnant, knowing that she's going to have to give birth in a government hospital, what can we tell her now? What is it that she can expect? How does it work in a government hospital to give birth?
Okay, well, government hospitals are really, it's a stressful place, it's a high risk place, and it can be very fearful. And I think there's a lot of misconception around how your government hospitals work. So I think, first of all, she needs to, if I can just touch on the preparation just a little bit, she needs to go and book early enough at a clinic, and then they would see where her pregnancy falls, if she is a low-risk pregnancy or a high-risk or intermediate pregnancy, because that will determine which hospital or which setting she will be able to birth in. For example, if she is a low-risk pregnancy, she will be able to birth in a MOU, which is a midwifery obstetric unit, or a level 1 hospital. Then that means she also needs to go in her district or in her zone, because now we are dividing into zones, especially if you live in Cape Town, Johannesburg, Pretoria, where you have many hospitals. You are allocated to a zone and you have to go to that hospital or to that MOU. And if you go to another one, then they might start sending you away. And then you get a lot of complaints of women saying the government is sending me away or the clinic is sending me away. Maybe if you start at the one that they sent you to, you can negotiate and ask for a referral to another institution, and from there on. So there is a definite system that you need to follow that feels very frustrating, but because of the amount of women that we see in service, it's unfortunately necessary that we stay in those catchment or those zone areas.
Yeah.
Okay. Then, of course, she can book. When I say book, it means attend antenatal classes or consultations at a government clinic or at a private doctor or with a private midwife. It's really no problem. I think, and to maybe soften the blow of what you might expect, when you walk into a government hospital, especially if you're maybe a high-risk pregnancy or an intermediate risk, please visit the hospital or the MOU before the time. I have found that helps women a lot if they can come beforehand and just meet the staff and have a walk through the ward. Most of the time, most of the midwives, even if they are very busy, they try to accommodate people. Even if you can even ask for the unit manager or the shift leader to take you through the ward, and she will show you where the bathrooms are, where the rooms are, where you'll be giving birth, where you'll be admitted. You hopefully see some friendly faces around, and then you have a little bit more of an idea of what you might expect, and then just ask about certain things. Ask whether the birthing partner can come along. Ask if you have, especially if you have any dietary requirements, if you are a vegetarian or halal, Muslim, or you need or maybe Jewish and you need you follow a specific diet, just ask them how they can accommodate you, or do they accommodate you. That just eliminates some unpleasantness maybe on the day that you have to come, and some miscommunication that you might have. Maybe then if there's no halal food there, you might be able to bring your own things and you won't starve, or feel that you are neglected or discriminated against or anything like that, because we really try to eliminate those type of problems.
That's
sorry.
That's a lot of tips that you're giving there.
Sorry, that's
amazing.
A lot.
No, that's amazing.
That's
so let's just unpack it a little bit.
Yes, go for it.
Yeah, no, that's brilliant information. So definitely the booking at your local clinic is super important, and that you have good antenatal care and that you find out where are you eligible to give birth. Like that you point out that you can also go to a MOU, especially in the bigger cities. Just explain a little bit what a MOU is. Because that is something that where you most likely have your most natural birth experience, right?
Yeah. So your MOU is your midwifery obstetric unit. So it's a unit that's most of them run 24 hours a day now. There used to be some, I think, a couple of days that were only open during the day, and then you had to go to the hospital at night. But I think most of them are now 24 hours. It's only midwives there, midwives and nurses. And you are really encouraged to mobilize, to walk, to drink water. Some of them, I think, might have baths. The ones that I've been exposed to, unfortunately, didn't have a lot of infrastructure. But what they lacked in luxury, they made up in cleanliness and safety. So a lot of places we tend to think it's very dirty, and it's actually quite clean. So they clean quite regularly. It's a great place as far as government goes to have a natural experience.
Yes, yeah. So remember that the maternity obstetric units as midwife-led units. And then I also really like that you point out that it's so helpful to go visit where you're going to give birth, because then you can already visualize a little bit and prepare yourself, a bit more what to expect, that you can be the calmest version of yourself going there when you are in labor, because we know that for birth to go well, you need to be very calm. You can't be stressed and full of fear. So whatever you need to do to reduce your fear, that this is a really good way of doing it. And then also realizing that there are actually quite a lot of amazing midwives and lovely faces in those maybe fearful environments. So that's also a great tip. And I also really like what you said, Kirsti, on the food issue. Definitely think of that. Also to see what you can even ask how often you get food, because most likely it's 3 times a day. And when you are in labor and you're laboring right through the night, you might need some snacks and some extra foodies, because giving birth is hard work, so that you can pack the food that you want and have some extra with you. Be prepared. So those, we already have given quite a lot of tips on how you can improve your birth experience. So I think that's really comprehensive on what you can expect in a government hospital. So do your homework and go visit and so forth. So Kirsten, I've already unpacked a little bit. Maybe you had something more prepared, because my next question for you was like, often women are fearful when it comes to giving birth in a government hospital, and how can they prepare themselves best? Well, you've already said quite a bit, but do you want to add on to that? Do you had something more that you wanted to say there?
Yes, I think definitely set up your birth plan. We tend to think that if your birth plan maybe is just something that they say to you on your antenatal consultations with your midwife, or maybe your obstetrician sits, it's not something that normally gets promoted or spoken about in a government setting or a clinic. It's not that people don't know about it. It's just that it hardly ever comes up. And because women don't come with birth plans, it's difficult to accommodate. It's not difficult to accommodate them, but you're not necessarily going to know what they want or what they expect from you. So I would still encourage women that even though you're going to a government hospital, especially if it's an MOU or a level 1, even a level 2 hospital that still see low risk up to kind of intermediate risk and certain high risk places, set up a birth plan so that we can talk and we can see where we can meet each other to make this as close to what you want. Because midwives there are midwives that are extremely harsh, difficult to work with. But there's really few that will not try to accommodate women. There are definitely midwives who try to accommodate the women as much as they want. And one of the things that I hear quite a lot from my colleagues is if I am trying to introduce them to a new birthing position or something new, they would say, "Oh, but the woman never asked for it." So, so know what you can do in labor as well, so that you can ask for it. If you are ready to be pushing or to give birth, then ask them, can I squat? I would like to do this, And if you have the birthing plan, then they know what you would want to do, and then hopefully they will accommodate you further. So that's one thing I want to say about that.
Yeah, well, I'm so glad that you point that out. So it's a matter of asking and putting down what you have in mind, but it also puts the ball a little bit back in women's court as well. So you also have a responsibility to do your preparation, to empower yourself on how to give birth, and then you can communicate that clearly and go in partnership with your midwife and the nurses in the hospital and talk with one another, because you're doing this together. It's a team effort. So communication is very important. You can talk and speak up for yourself and engage with the midwife that are going to be looking after you, because you spend most of the time they're there for a 12-hour shift, so they're going to be spending loads of time with you. So you've got time to build that relationship, talk about what is happening. So that is really great. So if you're not sure what a birth plan is, it's basically just going through your wishes for birth. And some of you, actually, some of our followers have been asking that, because you've been saying, if you ask for the more sensitive midwifery ways in a hospital, like freedom of movement and skin-to-skin care for my baby, or delayed cord clamping, that can't be done in a government hospital. That's been comments that we've been getting. So maybe it's just because you haven't asked for it. Am I right? So your experience, Kirsti, those things, do you practice them as a midwife in a government hospital? Do you suggest them? How do you work?
Yeah, so I definitely suggest, I try to work as much as like that as possible. And I just also wanted to say that the changes that they brought into the new maternity care guidelines is very, very woman-centered. And they want to make it as woman-friendly as possible. And there's a lot of initiatives from government that forces hospitals to do things differently. For example, we've got some national core standards, and there's a whole bunch of things, ideal hospital type of things where certain things need to be in place, and certain posters have to be on the wall. So there might be some posters there that's promoting freedom of movement and different positions for laboring. So use them. And if you're not being allowed to use them, you say, there's your poster saying that I can, So, but I definitely try as much as I can to give women the option. I've stopped delivering women on their backs since I think the first 2 years of being a midwife. I had this accidental squatting delivery, and it's the first time I saw it, because I've never had anyone. You're not taught this in while you're doing your nursing degree, and it happened, and I was like, "Wow, this is so cool!" Because I was so fearful of trying this, and not having a mentor to teach me, where do I put my hand. How do I support the perineum? Always so, how do I do this? So it was a very accidental squatting, and it went beautifully. And since then, I've really just changed everything. In the beginning, I used to cut episiotomies. When the moment it looks like I'm going to struggle, I would cut an episiotomy. So I was just as problematic as everybody else, I guess. And since then, it just changed. I think in the past 5 years, I've maybe had cut 2 episiotomies. I can't even remember what the reason was for. Nobody delivers on their back. So especially if it's a busy day and I see there's a lot of ladies, I just immediately, this is how we're going to do it. Are you comfortable? Yes, much better. Okay, great. Let's go for it. And delayed cord clamping, definitely. Skin to skin, definitely. All my births, all the ladies that birth with me. We've also started doing this in the theatres, because hospitals need accreditation as well. They need to be baby-friendly, mom and baby-friendly hospitals. And to get that accreditation, they need to do delayed cord clamping, and they need to do skin-to-skin in labour ward as well as in theatre. So it's definitely something that we are doing. I am one of the few midwives that does it really consistently, but and I'm not, there's no real issue that I've had with obstetricians or anaesthetists in theatre for me to do skin to skin or breastfeeding while the mom is like they're still busy with the mom. So I think it's also just a matter of asking and being bold, So we just have to be more bold. Yeah.
Yeah, Kirsti, it's really very, very encouraging to hear. That there are actually so many. There's actually change. The birthing culture is changing. Then, and I agree with you that the WHO regulations and guidelines are extremely women friendly and also encourage all these things that we are talking about. And that is, and I know that South Africa always are on paper really good in implementing WHO guidelines in all their protocols. I think it's just going to take some time for all the midwives to catch up. Yeah. But I think these days everyone is online, and there are so many. You can do your research, and I know we're all busy changing and relearning a few things. So it's so encouraging to hear that you've been able to practice that freely in a government setting. Tell me your experience with working with some midwife colleagues. How is that aren't used to working the way you do? How do you manage that?
I just do whatever I want to do. So,
yeah, you work on your own and not all together. Say again?
Yeah, so I've got the evidence on my side.
Yeah,
that's what I always stand on. And if you know what you're about and you've got it, then people can come and question you. They can confront you, but at the end of the day, you have the evidence on your side, and you have the legislation on your side, because you offer things differently. And these things are not pulled out of the sky. They are part of your Bartopele principles. They are certain things that are part of your constitution. I've actually got the Bartopele principles here, but for example, consultation, informed consent, these type of things, how a woman chooses the services that you offer, these are things are part of the Bartopele principles, and we just need to relate it to the work that we do for us to make sense, for us to let it make sense, So, that's what I always feel. I'm never rude. I always try to stay humble. And then you can give the evidence that you have. And people, because they don't always know, they can't argue with you.
That's the thing. It's more that we also know, because as you said, we all had to unlearn a lot of things because we've been all taught a certain way, and then we discover as we go, and we're unlearning. We're all on that journey. And we're all learning and growing together. So I love that. And I just it's a win-win in the end. I mean, it's going to make everyone's life easier, right? Natural midwifery is just, it's low tech. It is the best for mom. It's best for baby. Exactly. If we could just all really learn to trust in Mother Nature again and allow it to do its thing, then it doesn't matter which setting you are, this is the thing. It's for every setting. It's not like a only at home scenario. It can be done everywhere, natural birthing. And I'm so passionate about it. And I know you are. Yeah. You wanted to say something.
I've started asking the obstetricians to do delayed cord clamping in theatre, and it's actually well received. So, so it happens. You must just be bold and ask for it, and then it happens. But the other things that I can just say for women as well. One thing that was very encouraging to me, seeing it from a hospital, is there's always this type of perception that when do I go to the hospital? And actually, the nice thing at the moment is that if you come to the hospital and you really can't stand it anymore, and you come in and you are being assessed to see whether you're in labor, they actually send women home who are in early labor. And I was so encouraged about that. So if you do come in at 2 centimeters dilated or whatever, and you have transport back home, then go back home. You don't have to stay in the facility. You can go, come back when things are really, you think like you've held out long enough or whatever. But then you don't have to feel like you have to stay where you are. If you are there and it's early labor, you can go home. If there's no risk factors, then definitely you can ask to go home and come back when things are getting too strong. So that was I really love that. And I try to tell all my patients that as well. So you can go home, right? You don't have to stay here.
Yeah, just come back on time.
Yeah. So if you're not sure, I guess that also just ties in that if I just going to go just a little bit back, if you go to your antenatal clinic, and sometimes the information that they give you might not always be the best, or things are missed because of the amount of people they see and all those type of challenges, then just make sure that you prepare yourself and you prepare your body for labor, and you prepare your mind for labor, because you don't know what you're going to get once you get to the hospital. You might come on a good day where things are quiet, or you might come on a bad day where you're going to wait for a bed for quite some time. And you need to be able to stand that marathon. You must be able to stand it alone as well. Yeah. Because now with the COVID waves, it was so up and down. Now someone's allowed to come in to support you. Now no one's allowed to come and support you. It was so tough for the teenagers that had to give birth alone. So you would see 14-year-olds or 15-year-olds giving birth alone, and it's just heartbreaking because they are not prepared. They do not know what to expect. It's completely, it's something completely different. So I would just encourage women to really prepare yourself if you go through government. Use your data wisely and look at how to prepare, look at the signs of labor, how to time your contractions, when to come in, know what's the criteria for the hospital. And if you are a high-risk patient and you get to be referred, then follow up on your referral and see where you go from there. So you must just really prepare yourself for it so that you don't come to the hospital too early or for unnecessary things or for, whatever.
Exactly. Yes, and it's good that you pointed out to just also understand the context. I mean, the reality is it is a government hospital. You never know what you're going to get on that moment, how busy it's going to be, the amount of people that some settings need to deal with. So just to be considerate about that. And the more you are prepared, that's what I'm hearing from you, is the better. And that is for birth across the board, like own your birth, do your homework. If you can, get antenatal classes. These days you can do antenatal classes everywhere. I think I hope that we will get more antenatal classes done at government clinics, but also there they are so busy, or they hide behind their busyness maybe, but
a lot of the times,
antenatal education should actually be part of antenatal care, in my opinion, because we win so much as healthcare professionals. It actually really helps if a woman is well prepared. It works well. So we also put a responsibility in women's hands, and that we all here for empowerment in that regard. Yeah, so sure, this is really very, very worthwhile information, Kirsti. I think you've given all your best advice and tips you could for the women out there. One last thing I would want to talk about. You did touch a little bit on it with COVID. It's difficult to get a support in, but how's it going at the moment? And even outside of the COVID world, in government hospitals, who can you take with you for birth support?
Okay, so at the moment, what I think sometimes it's at the moment it's very much based on the institution that you're going to. Still, I think because some institutions, so you need to just follow up on that as well. By yourself. But at the moment where we are is birth companions can be allowed from about active phase of labor. So when you're about 5 centimeters dilated, or when you're allowed to go into your own labor room, Most of the time, partners are allowed to go in and to stay for an hour afterwards. If you go for a Caesar, as far as I know, well, with us, fathers are not allowed to go into theatre yet. I was asking at our hospital the other day, when can they be allowed to go in? And they were still going to have a meeting, so we're still waiting to hear about that. But then after the Caesar, then you might have maybe a half an hour that you can see your partner, and the partner can meet the baby. And maybe every day, once a day, one visitor. So it's still very limited, very closed. And some of the women still, especially if you're COVID positive, you're not going to see anyone until you are discharged. Yeah. So I think just phone the hospital, phone your labor ward, and just find out. And then the other thing is, these things change the whole time. I know sometimes in 1 week we can have 2 types of protocols or guidelines coming out that says, now we're doing this. This is how we're testing. And then, oh no, we're going back to the previous one. Or we're doing something completely different. Sure. So it's you have to phone and find out. It's something, it changes, very dynamic. It changes the whole time.
Yeah, it's been difficult times. It's been interesting times to navigate through. Yeah. So birthing partner is definitely always advisable. So if you can take someone to support you through those, especially active labor times, because a midwife in the hospital can't stay with you all the time. That is really also a really great way. And Kirsti, maybe can you shed light on doulas? Do you use doulas at all? Has that come in a little bit or still not?
The doulas were, I remember when I was in Johannesburg, the doulas were used in the MOUs. Some MOUs were using doulas. But I think the doulas were, some of them were really abused by the system. They're not necessarily nurses. And they were, the government always wants a person that can do more than what she's supposed to do or more than what she can do. So I think at some institutions will still use the doula, or some doulas still go for training in government institutions. I've heard of that still happening. But no, not really. It's not a standard thing. It's not standard. I think it's worth finding out as well if you are going. The thing is just government, people in government don't always understand the meaning of a doula. They think it's just a support person. So they will say, yeah, you can bring a doula. And then they think the doula is the husband. And then you show up with your husband and a doula and they're like, what's going on here? Yeah. So I think just make sure that they know what you want to bring. Yes. I think it would be a good idea if you can, because this is the ideal. The ideal is if you are low risk, that you come in at 8 centimeters dilated, give birth, latch your baby, 6 hours later, you can go home. That's the ideal. So I think if you can labor at home with a doula for that long, or with a midwife for that long, and then go to hospital, sure, I think that would be a great situation. Because some hospitals have baths, some have showers, not everybody has, or sometimes the water is cut off. So you never know what you're going to get. Yeah. In the hospital. So if you can stay at home, if you can stay at home at all, stay at home, birth with good support, labor with good support at home, and then come to the hospital. Yeah.
Just make sure that if you stay at home long, that you have good transport to get you to the hospital when things start to go quickly, that you don't wait for ambulance and then you are way too late. And just know the warning signs. I must just say that as a disclaimer as well. Just know what your warning signs are here. The journey of birth, it keeps us all night. Oh, Kirsti, I was so lovely talking to you. Absolutely enjoyed that. Wonderful. I wish you all the best of all your work, and I just know that the hospital is super blessed to have you and all these mummies. This was great. Thank you so much.
Thank you so much for the opportunity, Margaret. And thank you so much for what you are doing, Sure.
Yeah.
Great. Thank you.
It's my pleasure. I love it. Yeah. All right. Thank you. So that was us for this episode. I hope you enjoyed it, that you feel empowered. Share it with your fellow friend or sister that is going to give birth in the government hospital, and let us all empower one another. Thank you so much for joining us today. If you enjoyed this video, please share this with a friend who will benefit from this. And remember to subscribe and hit the bell icon so that you can be notified whenever we release new videos like this on our channel. We'd love to stay in touch and keep you updated with all our latest content and resources to equip and empower you. So if you're a midwife or any type of birth and baby worker, go to sensitivemidwifery.co.za/free gift. If you're a mom, visit sisterlillian.co.za/free gift for more training and resources. That way we can keep you up to date when we release new episodes like this, plus a few other bonuses. You can also find the links I just mentioned in the show notes. Remember, you're making a big difference because you are shaping the future of humankind. Thanks for watching, and I look forward to journeying with you. Breastfeeding is one of the amazing life experiences a woman and a baby can share, but it's not always easy. The truth is that breastfeeding is a skill, and like any other skill, you need to learn, practice, and be supported in order for it to become second nature. Sister Lillian Center Essential Breastfeeding course will teach you everything you need to know about nursing and how to love your breastfeeding days. Click the link in the show notes or visit sisterlillian.co.za/breastfeeding course to find out more about this invaluable course. And if you're enjoying the content, remember to share this with a fellow mommy or friend.